Good evening, everyone. Welcome to the Long COVID Clinic, What You Can Do with me, Dr. Binita Kane,
and me, Helen, Oakleigh, proud advocate and founding member of charity Long COVID Support.
We've got a really good session for you this evening. It is live and interactive, so if you are watching live, please do put some questions in the chat for our guest. We'll be keeping an eye on the chat. Helen will be popping backstage in just a moment, and we'll try and answer as many questions as we can. If you can't watch live, don't worry, it's recorded and will be available for everybody immediately after. So without further ado, Helen, we'll see you a little bit later. We'll pop you back. I would like to introduce my guest for this evening, who is Dr. Louise Oliver, who is an NHS GP turned breathing practitioner and enthusiast for all things breathing science. Brilliant to have you on, Louise. I'm really looking forward to our chat.
Thank you for having me, Binita.
So this is a topic that is so close to my heart. I mean, firstly, I'm a chest physician, and I've spent most of my career treating lung disease without really having a good knowledge of the science behind breathing for health, because it's not something we as doctors, and you'll vouch for this, we are not taught. And the more I've got into the chronic disease world, the more I've realised how important this topic is. And just to clarify for people watching, we are not going to sit here and say, this is how you breathe yourself better, you know, do a bit of breathing and you'll get better from long COVID, ME, whatever chronic illness people are suffering from. But this is really part of the puzzle. And for me, I see this as if people are not breathing efficiently, it's another thing that might be preventing full recovery, and such an important thing to correct. So let's start by, can you tell us a little bit about how you got interested in this topic, and you know, how does one go from being a jobbing NHS GP to suddenly being immersed in the world of breathing?
I don't actually know. I mean, probably, if I'm being honest, I've been a GP over 20 years. I became a doctor because I wanted to help people, and probably, I don't know, I can't remember now, probably about 8 years ago, I got quite disillusioned. I really felt that the patients particularly with a lot of chronic disease, I wasn't really helping them. Traditional medicine wasn't really assisting them. And I just randomly chose to learn about mindfulness. And then I just started learning more about other things we can do to help us. And along that journey, I linked the autonomic nervous system to breathing. And then I became a perimenopausal snorer and realized actually I wasn't breathing efficiently. And luckily I worked on it. And for me, my snoring stopped when I improved my breathing efficiency. And my sleep, my exercise tolerance, and my stress resilience are so much better. And I just thought this needs to be shared with other people. So it's just grown from there.
Yeah, okay. So this is a massive topic, and this hour will go very, very quickly. Let's start with the importance of breathing efficiency. In fact, can you kind of explain what is breathing efficiency? Because it might not be a term people are generally familiar with.
So if we think about it, how we breathe unconsciously is generally automatic, but that does not mean it's automatically efficient. So, you know, we can breathe efficiently, inefficiently, or anywhere in between. And we have a separation in medicine where we perhaps consider in respiratory medicine how someone breathes when they're awake. And then in sleep medicine, we consider how somebody's breathing when they're asleep. And actually, I think we need more collaboration between the two, and actually think, you know, we're not two separate people awake and asleep. We're actually, how's that person breathing unconsciously throughout the 24-hour period? And let's face it, you know, breathing is the foundation of life. So if we breathe efficiently, we're given an opportunity for every cell, tissue, organ and system in the body to work efficiently. Doesn't mean it will, but at least we're giving it an opportunity. And then if it's based on an inefficient foundation, yes, everything might work fine, but you're making it harder for your body. So, and none of us want to make it harder for us to function.
Yeah. So let's talk about the function of breathing. So I will say it in, like, you know, medical terms. We will go, the function of breathing is to get oxygen in and carbon dioxide out. Carbon dioxide, the waste gas, we want to get rid of that, and oxygen's the, you know, the thing we need for all of our cells. And actually, though, I think that traditional teaching is, it undersells it a little bit, doesn't it? Because there is so much more to breathing to this. So what are the benefits of having an efficient breathing pattern?
So essentially, there's so many benefits. So just our body just functions generally better, but we're going to get better oxygen delivery. So that's going to mean if people understand the term sort of lactic acid threshold, so that threshold where we go from using oxygen to not using oxygen, and then we might create waste products that are actually quite painful and might contribute to sort of post-exertional muscle pain. So it can help that. It can help sleep. I mean, I think if you're, and we almost need to stop there, don't we? Because if you're breathing really efficiently, your body feels safe, your body feels calm, and then when you're asleep, your body then, oh yeah, the breathing's fine. I can now prioritize repair, recovery, immune system, and do all those wonderful repair processes that should happen when we're asleep. But if the body is having to work harder with sleep, harder with breathing when we're sleeping, the body then gets distracted by maintaining breathing and takes it away from those repair processes. And I think the other aspect that's really important is how we breathe actually shifts the autonomic nervous system. So
okay, so I'm going to just stop you there because I want to unpack that. Okay. So there's a few steps to this, isn't there? So so I'm really interested at the moment in the whole journey of the oxygen molecule, right the way from the air, how it gets into our bodies, how it's transported through our blood vessels, how it gets into our muscles, and how we use that for energy. Yeah. And clearly breathing is a really important bit in the first step of that. As we exercise, our demand for oxygen goes up, and if we're not meeting the demand because our breathing pattern's efficient, we're not going to get enough oxygen being delivered efficiently to the muscle. So I think that's trying to paraphrase what you said earlier. Yeah. And what you've also said is that it's really important for good quality sleep. And this is huge in my patients. Like the patients with long COVID, ME, there is so much sleep disruption. And I think the third thing you said there is it's a stressful state for the body when it's not breathing efficiency. And so if you're not breathing efficiently, you might be triggering the stress response, which disrupts sleep, which prevents healing and rest and all the stuff. So so much to talk about in that. Where do we start with? Well, let's talk about the autonomic nervous system, because you've talked about that, haven't you? Where do we start? Let's start with that. I think a lot of people watching will be familiar with what the autonomic nervous system is. Can you just explain it again for anyone who just isn't familiar?
So the body in the background is controlling all our unconscious processes that we don't need to pay any attention to. So like at the moment, I'm not thinking about my blood pressure, pulse, saliva, pupil size, whether my hairs are flat, stood up, my bowels, bladder, genitals, temperature control, all of that's happening in the background, and the autonomic nervous system is controlling that. And it's a complex system, but if we talk about it in simple terms, it's divided generally into, we consider it to be divided into two. So one aspect is the fight flight and sympathetic response, which gets a really bad rap, but actually it's made us survive and develop, and actually it's quite a good system to keep us safe. So when that dial is turned up on the fight flight system, when the body feels a bit of a threat to life, and it puts all those processes more into survival mode. And the opposite system, which I think we need to talk about more, is that parasympathetic nervous system, or rest and digest, feed and breed, or relaxation response. And when that system's turned up, the body feels safer, the body feels able to repair and recover. And obviously when we're asleep, we're meant to be more parasympathetically driven. So, but I think the one, and I have to say, I graduated from medical school in 1998, and I knew about the autonomic nervous system and I knew about breathing, but I hadn't quite made the link that actually if I breathe in a certain way, it turns the dial up on the fight flight, and if I breathe in a certain way, it turns up the dial on the parasympathetic relaxation response. And I didn't realize. And if we just take an example, like a real life example, I was running, someone accidentally let go of the dog. And there was no thought process in it. I thought I was going to be attacked. And I just started to go. So I was upper chest, big breaths. It was using my mouth, and it was fast. And actually, I held my breath on the inhale a couple of times. And what actually happens there is my amygdala, so that area in the brain that has a role in fear, is actually looking at my respiratory center and sees that I change my breathing pattern to that, and then sends the signals around my body that there might be a potential threat. Luckily, thank goodness, the dog owner got the dog and I was fine. And I knew I needed to breathe the opposite way. So I knew I needed to close my mouth, breathe slower, breathe gentler, and breathe with my diaphragm. And again, my amygdala saw me change my breathing pattern and then sent the signals around that she's safe now, she's okay. So how we breathe actually instructs the autonomic nervous system. And I think I wasn't aware of that as a doctor. And I think, I think that message needs to get out.
And the autonomic nervous system is so underrated and understudied and underappreciated in medicine. It's unbelievable. And once you sort of know about it, you can't unsee it. You just see autonomic dysregulation in any sort of chronic illness state. But it's interesting what you're saying, because when people get bad news or a shock, they breathe in that sympathetic stress, that stress, and then when you're relaxed, it's that parasympathetic breathing out. And there is that constant sort of push-pull of the sympathetic and parasympathetic nervous system as we breathe day to day with every different heartbeat that we have. But we can dial up in one direction and dial down in one direction depending on how we are breathing. So that very short, shallow, upper chest, mouth open is very stressful, and low, slow, diaphragmatic breathing is very good for our parasympathetic. And I think people don't necessarily realize that if you're stuck in that sympathetic overdrive, it's not meant to be efficient. It's survival, and it is fatiguing, it is exhausting, because it's sort of intended to be that way. And a lot of my patients are kind of completely stuck in that, in that state through their illness. And this is a powerful way to try and correct that, isn't it? So let's move on from that, and we'll come back to that in a bit, but let's talk about nasal breathing. Or let's talk about what is normal breathing.
Yeah. So if we think about it, when a baby comes into the world and it's using its nose to breathe, so the entire human body has been designed to use the nose, to breathe in and out of the nose. And my respect for the nose has just gone like out of this world. It's an organ. It communicates with the entire body, and the difference between breathing through in and out of your nose and in and out of your mouth is profound. The mouth is there as a survival backup mechanism. So from how we should breathe, it's in and out of the nose, and just the way the body's connected are, if we think about it, our nose is connected to our brain. So our nose is directly connected to our memory center, the hippocampus, and directly related to our amygdala. So again, that fear response, because we used to be able to have to smell something and work out, is that helpful or unhelpful for survival, and then remember it for future use. So we're not designed to use the mouth to breathe normally. It's just a survival mechanism. But I think just modern day society, for various reasons, is definitely fueling more a mouth breathing pattern, and certainly chronic disease and such like as long COVID, etc. It does tend to fuel a more upper chest, fast mouth breathing pattern. And unless the individual knows that and then has an opportunity to correct that, they're potentially missing out on something that might be helpful.
And yeah, I think I also have developed massive respect for the nose since getting into this kind of science. And there's a absolutely brilliant book called Breath by James Nestor, which I thought was quite a life-changing read. And he's a journalist, and he sort of spent 10 years researching this stuff and then wrote a book about it. And it was, as a chest physician, I think it was one of the best things I've ever read, because I was like, wow. So, you know, James, if you're watching ever in the future, thank you for writing that book. But there was so much I hadn't realized about how we've evolved as humans. That has moved us away from nose breathing, how modern life, how chewing soft food, how our environments, how we now have more nasal allergies, and we've got smaller jaws and we've got tighter throats. All of this affects our breathing. And I hadn't realized all the benefits of nose breathing, because apart from the fact it's just normal, there's huge benefits of doing it over mouth breathing, isn't there? So what are some of the benefits quickly of nose over mouth breathing?
So I had this moment when I suddenly realized James Nestor's book was one of the reasons, and I think everybody should read that book, and especially health professionals. But I suddenly thought, oh my goodness me. So when we use the mouth to breathe, we're bringing cold, dry air, unfiltered, straight into our lungs, and cold, dry air triggers cough and wheeze, and there's no filter, you know, whether there's pollen, virus, bacteria, any pollutants, straight down into the lungs. Whereas when we use this, we're warming the air, we're moisturizing the air, and we're filtering the air. So it won't filter out the very, very tiny particles, but it's much better than no filter. It also slows us down, because generally most people, the two nostrils would be smaller than the mouth. So by definition, we then tend to breathe slower and gentler, which again fuels that parasympathetic response. If we've got a mouth open, it's much, much bigger. Our nose and sinuses create something called nitric oxide. So in our body, it's a wonderful chemical. It actually acts as a bit of a disinfectant. So it has an antiviral, antibacterial mode, but it actually helps open up the airways and the blood vessels in the lung, which again helps that oxygen delivery to the rest of the body. The nose, the nose, tongue, we're all connected down to our feet. So we're more likely to use our diaphragm if we're nose breathing. And if people just quickly put one hand here and one hand on their upper tummy and they breathe in with their mouth, you can, certainly for me, I have a lot of upper chest movement. If I breathe in through my nose, there's not as much upper chest movement, and my diaphragm moves. So, and we know that the diaphragm is that muscle that sits underneath our lungs, and at rest, generally about 80% of the work should be done by that. So you can see simply from that demonstration, we're more likely to use the diaphragm, and the diaphragm creates pressure changes in our chest that just makes it easier for the blood and the air to come in and out of our body.
I'm just going to emphasize this point. I know we're slightly moving away from the nose now, but there's more benefits than what you've just described there as well, which, you know, we won't bore you with all the benefits of nose breathing. Hopefully we've persuaded people it's the right thing to do. But the diaphragm, so breathing, when we breathe in, the lungs move in three directions. They go up, out, and down. So the rib cage moves the lungs up and out, and the diaphragm, which is the muscle in between the chest and the tummy, is usually domed, and when we breathe in, it flattens and pulls the lungs down, which should push the tummy out. And most people do not realize that 80% of the breath should come from that diaphragmatic movement. And therefore, if you are not using your diaphragm, and many of my patients, I do a very simple test with them, they are splinting their diaphragms. They're not using their diaphragms at all. And then I say, okay, now really try and push your tummy out when you breathe in. And they go, oh my, that feels painful. It feels weird. So those patients are only using sort of 20% of that lung capacity, doing very short, shallow breaths, whether it's through the nose or the mouth, which is incredibly inefficient and can create all sorts of symptoms in the body as well. And lots of symptoms associated with breathing pattern disorders. Go on.
And well, just from that, obviously, if you're not using the diaphragm, you then, because you're using your upper chest, you're using these accessory respiratory muscles, which are not designed to be used all the time, and they're much smaller muscles. And obviously, if you're, you know, if the shoulders are moving because they're having to do all the work, obviously these muscles are attached further down, and then you can cause muscular tension at other parts in the body because of that. So it's really quite profound.
Yeah, and also, you know, if you think about the fact we breathe over 10,000 times a day, and if you're putting strain on the upper neck and the back muscles, and people with POTS often have pain there anyway, because, you know, coat hanger pain is part of POTS. They have this terrible neck and back pain, and they don't realize it's to do with basic breathing pattern. And then you can get all sorts of other things as well, you know, pains in the chest and headaches and all sorts of, you know, it can in itself cause some fatigue symptoms as well. And as you say, sleep disruption. So how do we go about trying to assess whether we're breathing properly? Because I think this, and what are your tips? And then we'll get into maybe some slightly more advanced concepts of oxygen and carbon dioxide, and we'll think about that. But what are the basics of, look, you know, if you had to do a self-assessment?
Yeah. So I think the first thing to say is we don't have a really simple gold standard tool that everybody agrees on, which actually makes it very difficult to research. But I'd say just the simplest thing is just notice how you breathe. So if this is a new concept, over the next week or two, just keep checking in and notice how you're breathing. And if we think about, I think about how you breathe when you're resting, moving and sleeping. So if we think about how we breathe when we're asleep, now you may not know, and obviously it might be then use a snoring app or something to record your breathing. But in my experience, a lot of people do know how they breathe when they're asleep, because they've shared a hotel room with somebody or they have a sleeping partner. You know, if you're sleeping with your mouth open, you've got noisy breathing, you're stopping breathing during sleep, there's some inefficiency there, because that's your unconscious breathing pattern when you're asleep, and there's some aspects of that sound like it's not as efficient as it could be. The next aspect would be obviously consider how you breathe when you're just sat there. You know, are you breathing using your mouth? Can you, check in and how much of your upper chest is moving? Can you see your shoulders moving as you breathe? Are you using your diaphragm? Can you hear yourself breathe? Because at rest, we don't actually need that many liters of air. And if you can really hear yourself breathing, then it might be you're over breathing. So it's worth checking in with that. Are you yawning a lot? Are you sighing a lot? There's lots of different causes for that. But one is if people are not breathing efficiently, if they've got a breathing pattern disorder. The other aspect is when we exercise. So obviously it's normal that when we exercise, we're going to be breathing a bigger volume and breathing faster. But often people have an idea of how much extra I should be breathing. And sometimes you'll hear people say, I just breathe so excessively when I'm exercising. I didn't used to breathe as much as that when I was, walking or, doing yoga or something like that. So are you breathing excessively for the amount of activity that you're doing? There is a tool that Keisel and colleagues wrote a paper on in 2017. It's not a diagnostic tool, but it was quite helpful. They looked at different ways of assessing breathing. It's a little bit involved, but I've done a video on it. So on my YouTube channel, I'm sure you'll link it. I've just got to think it's a 4-minute video, and I described the assessment tool that they used, and someone could use that if they wanted to. But I would just say, just notice your breathing. And the other thing is, if you're unconsciously holding your breath, particularly after the inhale, that sometimes indicates it as well.
Yeah, and so I think that it is interesting actually, because when I'm in clinic, I will be assessing someone's breathing pattern at rest, and then I don't necessarily look at their breathing pattern and think about it at night when they're asleep, although obviously since we've been chatting I do that more now. And then it's that bit on exertion as well. I do that more in my respiratory clinic rather than long COVID, where I'd get someone to maybe who's really breathless but doesn't seem to have anything wrong with their lungs. X-rays okay, oxygen levels are fine, lung function's fine. Get them to jog on the spot, and it's really quite interesting how very quickly people will and the oxygen levels are absolutely fine, but they feel very breathless. So I think that's a really great tip to think about those 3 separate stages. Another symptom that's very commonly reported to me is I don't feel like I can take a deep breath in, or I feel breathless when I talk. And those are really strong signs of a breathing pattern disorder as well, because you clearly shouldn't be breathless when you talk, unless you've got very, very severe lung disease. So I think that's really helpful. I think something else that I sometimes just ask patients to do is just try and notice what's happening when you breathe in to your tummy. Is it going out? Is it going in? It should go out. So that's quite an easy sort of test. And there's a really great website called Physios for Breathing Pattern Disorder. And there's lots of resources on there. And there's a really good video on there of how to sort of do an assessment. So you could have a look at that, and we'll link it as well. Let's talk about over breathing then. So we've sort of nodded to it, haven't we? That it's not good for you. It triggers the sympathetic nervous system. Can we talk a little bit about the biochemistry? And it gets a little bit complicated here. But if we think of the simple concept of, as you know, we breathe in oxygen and we breathe out carbon dioxide. Yeah. The carbon dioxide is seen as this waste gas. But let's talk about why it's not really, we shouldn't think of it as a waste gas. We should think of it as a really vital gas for life. Let's talk about that.
So breathing is really complicated, and but essentially there's 3 dimensions of breathing. So we're obviously going to dive into now what we call the biochemical dimension, but there's also the biomechanics, that's using the correct muscles. We've touched on that. And then there's also another aspect that's the psychophysiological one. And that's that generally if we breathe slower, that helps our autonomic functioning as well as feeling calmer. So I have to say there's a lot more research and a lot more talk about using the correct biomechanics, so breathing with the diaphragm and breathing slowly. So we have a lot of research and discussions about that. But then we've got this whole dimension of breathing, which is to do with whether we're over breathing and our waste product. So if we think about it, this is a really crucial point I would love people to really understand. At sea level, when we breathe in, 21% of the air we breathe in is carbon dioxide. When we breathe out, 16. We're at sea level. We're breathing in, 21% is oxygen, and then as we breathe out, 16% is oxygen, and that is a really crucial point, because then you understand. Oh, so I've only used up a tiny amount of the oxygen that I've put in, and I'm throwing out, there's still 16% oxygen in the air I'm pushing out. Even when you exercise, there's not 0 oxygen in the exhale. So if you ever hear anybody, pardon?
I was just going to say that, of course, when we do CPR and you are literally breathing mouth to mouth into somebody else's mouth, you are delivering 16% oxygen. That's why you do it. So yeah. Exactly. You're not short of oxygen. Oh, we're not short of oxygen from the air, are we? Okay.
But what do we hear people say? In an exercise class, take bigger breaths to get more oxygen. But that's wrong, because you're throwing out oxygen you're not using. So that concept, I think, is really important, that by taking a bigger breath in, you are not going to get more oxygen. So as we breathe in, we take oxygen, and oxygen will be on the blood cells, it goes around the body, and then the oxygen goes to the tissues. But the aspect that gives more oxygen delivery is carbon dioxide. So, and the body has designed it that way really cleverly, that if I was using a muscle, so say I was chopping wood with this arm, this muscle is getting warmer, but it's also producing more waste product because I'm using it. And then that's a signal, because there's more carbon dioxide, there's more waste product, that's a signal for the body to release more oxygen. So when we have more waste product, it actually helps release more oxygen from our blood cells. So we want to be we want to be tolerant to carbon dioxide, because then that allows us to release more oxygen to our blood cells. But
so I'm going to just stop you there, Louise, because this is a crucial point, okay? And so what you are saying is that the level of carbon dioxide in the body directly affects how well our blood cells give up oxygen to the tissues. So if you're over breathing and you blow off all your CO2 and your CO2 levels are quite low, you're going to have less oxygen. Your body's going to hang on, the blood cells are going to hang on to the oxygen much more tightly than if you're breathing slowly and calmly and you've got that CO2 that's built up, within the normal range, but it's built up in, a good range in the blood, and you're giving oxygen much more efficiently to the tissue. So actually, you can breathe in all the oxygen you want, and but if you haven't got the right carbon dioxide levels, you can't get it efficiently into the tissues. And I think that's a very poorly understood concept.
Yeah. And this is where it gets a little bit complicated, because obviously the body will always want to try and bring the body back to the baseline. So definitely some people that overbreathe have low carbon dioxide levels, but some have normal carbon dioxide levels, but seem to be, or appear to be, to me, to be intolerant to carbon dioxide. So just that little bit of extra amount of carbon dioxide that's created, they don't seem to tolerate it, and they get what you've just described, air hunger. So air hunger is that you can describe it as even feel like I'm not getting enough air in, or I need to take a bigger breath, or I cautiously use the term, but feeling a little bit suffocated. So any of those sensations, that's a feeling of air hunger. And we get that when we reach our personal tolerance to carbon dioxide, we experience air hunger. And what I'm finding is in patients with long COVID and with lots of other chronic diseases, and at certain points in our life, we become less tolerant to carbon dioxide, and the air hunger comes on quicker, but then that impacts the oxygen delivery. But we can retrain our body. We can retrain our body to be more tolerant to it.
Yeah, and on the converse of all of this, if you were a free diver and you wanted to be able to hold your breath for minutes underwater, what people do is they hyperventilate. Is that right? Beforehand, they do. I'm getting this right in my own head.
Well, they used to do that, and then they found out that unfortunately that was really dangerous, and some people were dying. So now they've changed the way that they do it, and they do a lot of. There's lots of. I've not done free diving myself, but one aspect of their training is they train themselves to be incredibly tolerant to their waste.
Yeah, that's right. So they train themselves to be able to tolerate these huge doses of carbon, because it's carbon dioxide building up in the bloodstream that gives us the urge to breathe. And so it's when you need to take that breath in through your mouth. That's when you've hit your threshold. Anyway, I feel like we're getting into the weeds a little bit. So let's bring it back to being very practical. So I think we've made the point that carbon dioxide is really important for oxygen delivery, and training ourselves to be more tolerant to slightly higher levels of carbon dioxide is going to help us get more efficient in oxygen delivery, which might help relieve symptoms, and it might help improve exercise threshold as well in people who are chronically ill. So how would, just conscious of time, so in the next 5 minutes before we go to questions, how would you approach addressing someone's breathing pattern? And I know that's really hard because it has to be individualized, but kind of, can you give us a sort of a high level overview?
Yeah. So I think, I started experimenting on my poor patients when I was in doing contraceptive procedures. So I fit coils and implants for HRT and contraception, and I got them to breathe in different ways. So I very much concentrated on slow diaphragmatic breathing initially. And one lady I had a profound experience with and put her in a very, very meditative state. She was very anxious about the procedure, and she became very, very relaxed. But I thought, I've cracked it. And then I tried it on other patients, and some patients were fine with it. And then some patients, I made them have by asking them to breathe with their diaphragm silently in and out of their nose, it made them have intense air hunger and they felt almost like panicky. And then I thought, oh, perhaps it doesn't matter. Perhaps I'll let them breathe in and out of their mouth. And I'm not bothered, let them breathe as loud as they want to. But then they became lightheaded and they got pins and needles around their mouth and pins and needles in their hands and feet, because to tolerate breathing like that, they had to significantly overbreathe. And then this is where I actually think the biochemical dimension of breathing is really, really important. And actually, if somebody's over breathing, so the biochemistry is about if you're breathing in excess of what your body actually requires, if you ask someone to slow down and breathe with their diaphragm, they find it incredibly difficult.
And that can actually stimulate the stress response, right? So you've got, yeah. And I've made this mistake with patients. I've gone, hey, practice this 5 seconds in and 5 seconds out breathing. And then they've gone and seen Robin, our physio, and they've gone, oh, that made me feel really panicky. Dr. Kane asked me to do that. And then he'll be like, right, we need to actually. So I think there is a really important basic step of making sure someone's basic breathing is correct before you try and do any fancy breathing things. And also making sure there's not an underlying lung problem. Yeah. Right. So I do worry that there's people with breathing pattern disorders who are doing all these hyperventilation techniques and also, Wim Hof and all these other things, and they haven't got their basics right. And they haven't had an assessment by anyone to make sure they don't have an underlying disorder. I don't know what you think.
So I think people really, really need to understand that when we deliberately change our breathing pattern, we have the power to change our physiology, our biochemistry, and potentially our anatomy. And actually, I think the person needs to understand that, and the person who's teaching that. And sometimes certainly what I'm seeing on social media, I'm not convinced that is completely understood, particularly by people who are teaching breathing. And actually, the structure that I use is, we can do all sorts of things with our breathing. Honestly, it's like, it's like tapping into your body. But there's three things, the three questions that I ask if someone wants to deliberately say, what exercise is right for me? Well, I'd say, first of all, first question, are you breathing efficiently? And does the breathing exercise improve breathing efficiency? Second one, what's the aim of the practice, and does the science actually fit the aim? Because I don't always see that's correct. And the third one, is it right for this person at this moment in time? Because it depends what they want to do. And for me, the deliberate hyperventilation practices were designed years and years ago in a time when we were probably breathing as we've been biologically programmed to breathe. And those techniques were designed for a specific purpose at a specific time, maybe to warm somebody up or to create sexual energy. It wasn't that you go to a class once a week on a Saturday to overbreathe, because that's not paying any attention to. So the first question I would ask is, if somebody wants to do a hyperventilation practice, my first question is that person breathing efficiently? Because hyperventilation is not efficient breathing. So if someone's not breathing efficiently, for me, would it not make sense to do a practice that's going to improve the breathing efficiency? And I've had clients that have joined my programs who probably have undiagnosed obstructive sleep apnea, and they're going to a regular class to practice hyperventilation, and hyperventilation drives the stress response. So I have huge concerns that people sometimes don't understand. And on one podcast, anyway, I won't go into it, but anyway, yes. So I think it's complicated, and I think it has to be really personalised.
And I think, just to summarise, because we are sort of out of time, and there's lots of questions coming in, so we really want to get to those. But just to summarise, I think to breathe normally, from what you said, you should be breathing through your nose. Yeah. You should be breathing quietly. You shouldn't be able to hear your breathing. You should be breathing from your diaphragm, and you shouldn't be experiencing any air hunger. And we should be breathing at what rate? How many per minute?
Or the slower the better, but I don't like putting rates on it, because particularly in patients with long COVID, because the potential is if you concentrate on what breathing rate to go for, people stick to that and then don't respect and over breathe to maintain that rate. So the slower the better, but
that's a good tip. And you know, some of the heart coherence type breathing, which I haven't got time to explain, talks about 6 breaths per minute. That's really quite slow. Most people would breathe at something like 12 to 15 breaths a minute, but if you're breathing at 30 breaths a minute, that's obviously, you know, you're very breathless, and that's clearly very abnormal. So I think we can give a bit of a scale there of what normal is, but you're dead right, it's got to be bespoke to the individual, hasn't it? I told you this would go quickly, and we're just getting into the meat of it there. So I'm going to bring Helen back on stage, who's been keeping an eye on the chat. Hi, Helen.
Hey.
Hi, we can hear you. It's all good. So yeah, do you want to fire away with some questions?
Yeah, I just wanted to say as well, thanks for this. It's obviously a topic which is controversial for some people, and it shouldn't be, because, you know, some people, of course, are very experienced in even teaching breathing and still get very sick. For example, I've worked for 20 odd years as an actor. You know, breathing technique was a huge part of my work. You know, it's not about that. It's about the whole thing together. And it's really important to understand that it's not a failure of a person or anything like that. But also, it's not the full answer, you know, and I'm glad that you've made that incredibly clear, both of you, because it's not nice when it feels like that's what's being thrust onto you as a patient. So yeah, important to make that clear. So many questions. So we'll start with a kind of an order, I guess. So these are kind of linked in a way, I guess. There's a question about yoga nidra, and your thoughts on that. Personally, I'm a huge fan. Most nights I listen to some form of it, actually. What are your thoughts on it?
Can anything? Yes.
So can we just read the question out, Louise, just in case anyone's listening to this and not on the screen, for watching on a screen.
So question: I do coherence breathing and yoga nidra to try to get me out of my fight-flight mode, but long COVID makes it extremely difficult. Anything can trigger me and put me out of control. Any tips? So the first thing that strikes with me is coherence breathing is you're breathing to a specific rate, and what I'm finding is often patients with long COVID can be through no fault of their own. I presume it's because, I don't really know why, but I presume because the virus is so inflammatory, it drives that fight flight response. And then it just, perhaps you'll expand further, Binita, but it tends to make people really carbon dioxide intolerant. And then if you're trying to breathe at a slow rate, you hit your air hunger. And this is what I find. So for me, obviously that really coherence breathing and yoga nidra should make someone feel very relaxed. But if you're feeling a stress response, the first thing I would be saying is, well, what's your carbon dioxide tolerance like? Are you experiencing air hunger? And actually, is it actually, instead of concentrating on breathing slowly with the diaphragm, actually we need to improve the carbon dioxide tolerance first?
So I would just add to that I think in long COVID, there's loads of different places in that oxygen pathway where things go wrong. So there's the breathing pattern, then there's the it's how oxygen is getting from the blood vessels into, through the little micro capillaries into the tissues. There can be clotting issues, there can be blood vessel inflammation, and then it's how the tissues then extract and use the oxygen. So the mitochondria can be affected. So, and some people have all of that. And so every step along the pathway, so it's not just, and then they can have low circulating blood volume if they've got POTS. So that's reducing oxygen delivery even more. So there's all of these different touch points, and then you can get respiratory muscle weakness that's been described, and I've definitely seen sort of weaker diaphragms post COVID, and so on and so on. There's loads of different complicated reasons why, and I completely agree with you on your answer. I just think some people are doing coherence breathing and over breathing, so they're doing so over breathe. So if you are doing coherence breathing, it should be really, really quiet, low and slow. Yeah. And the other thing is, as you say, some people don't have a corrected breathing pattern, and then they're trying to do slow 6 breaths a minute, and it's not going to work, and you're going to get that air hunger. And if we have time, perhaps you can teach people how to know what their carbon dioxide tolerance is. We'll maybe talk about that in a minute. Go on, Helen.
That would be great. Well, yeah, that kind of leads into the other question, which covered Wim Hof, which is exactly that type of breathing. But of course, some people do benefit from it. It's just knowing where you're at, which is what you've made clear. So I guess that answers that question already. So next one is about HBOT, and what are your thoughts on HBOT? So that's hyperbaric oxygen therapy in the oxygen tank, for anyone who's not aware. Under pressure, like the divers.
So I, to be honest, it's not an area that because I can't access it as a GP. I've no experience with it as a breathing practitioner. For me, because breathing is so basic, isn't it? How we breathe 24 hours a day. And I would say, before considering that, what's your breathing efficiency like over 24 hours? Because I don't know. If you're not breathing efficiently, wouldn't you be better to correct that and then try that therapy, because potentially that would be more helpful? Because but I don't know, it's not an area I've got any expertise in at all, but my passion is just to encourage people to go back to breathe as nature intended, and then all these other techniques add on that, and I think potentially work better. That's where I come from.
I completely agree with you. We're sort of trying to force oxygen, into a situation where you can't use it efficiently if you're not breathing well. But, the evidence base for HBOT is very much, there's years of evidence in head injury and MS and some of these other conditions. And it's supposed to encourage new blood vessel growth, angiogenesis. There is a trial in long COVID that shows it can improve cognitive dysfunction. So there are definitely some benefits, but I completely agree with you, Louise. I think we're trying to do treatments without addressing some absolute basic fundamental things first. But if you've got a really good breathing pattern, and I think it's worth trying, and lots of people do get benefit.
And I think the one thing I would like to say, I'm not coming at this, I probably stopped breathing efficiently when I was 10, when someone advised me to suck my stomach in to make it look flatter. And please, if anybody's holding their stomach in to make it look flatter, stop. It is not good for breathing. I probably stopped using my diaphragm at that point. The diaphragm's a muscle. I think my diaphragm got weaker. And then I spent 35 years thinking I was fine, but obviously getting stressed during medical school, probably started over breathing. I overbreathe when I talk. I do a lot of mouth breathing when I talk. And then the change of my perimenopause, I tipped and then started snoring. And I had no idea I wasn't breathing efficiently. I was running 3 times a week. I didn't think there was anything wrong. So I think, and this is why I'm so passionate about it, because I'm a doctor and I've completely missed for 35 years. I've not been breathing efficiently. This is a joke. And the benefits I've felt from improving my breathing, you think, gosh, and what I will always say is, I'm not saying it's a cure-all, exactly what Helen's saying. I'm not saying it's a cure-all, and you'll only know in retrospect when you've improved your breathing what things disappear or improve, and that was to do with breathing efficiency. It won't correct other things, and it's just a tool. It's a piece in the jigsaw puzzle, but it's an overlooked one. And if someone doesn't even know it exists, they've not got that opportunity to explore it. That's what I'm thinking.
And also what I would flag as well, while we're on the topic, is there is limited research, but there is some research which connects POTS with MS. And of course, MS charities do use HBOT. So it depends what end of the spectrum of chronic illness you're at, if it's likely to be part of your personal jigsaw. But it is a jigsaw, and it's finding out, will it work or not? And yes, doing things which are very easy first is crucial. And also I would like to flag, open the window daily. Make sure you're doing that, because when you're stuck in bed, often you're not well enough to do that, but really bring it right back to basics. Make sure that you have got fresh air. And if you're in crowded areas and you are lucky enough to be well enough to go out, be mindful of, is this an area that is a busy theatre space or concert space or whatever it may be, with really high levels of CO2 and not very clean air? Are there HEPA filters? Are there, real basics like that as well? Sometimes get forgotten about.
So there's a question here about who should assess our, I've just taken it off. Who should assess our breathing? A respiratory physio. I can't hold my breath since long COVID. So what advice would you give, Louise?
I mean, I think it depends how compromised you think your breathing is. I mean, certainly when I work as a breathing practitioner, I can't diagnose anyone. So I just talk about, are you breathing efficiently and do you want to improve your breathing efficiency? But obviously, if you think your breathing is really compromised, as you've said, you might actually need to go and see a clinician. Have I got an underlying condition that needs to be diagnosed and treated? Do I need to be seen in a respiratory clinic by a respiratory physio? I think it's a spectrum, and obviously if you think you're very concerned that you might have obstructive sleep apnea, well, you need to talk to your health professional about whether you need a sleep study. So I suppose it depends on that level of spectrum. But I'd always say, well, you can make an assessment of how efficiently you're breathing. You could make some changes to try and see if you can go back to, as we said, basics, try and get breathing in and out of the nose if we can do, and breathing slower and more quietly if we can. But I think it depends on the level of symptoms, doesn't it, really? I think.
I'd say if in doubt, a respiratory physio is a really good place to start if you're lucky enough to be able to access one. I think that's the challenge, isn't it? I'm bringing this up because I think it's a really important question, but I'll hand it over to you, Helen, if you want to have a look at it. Or
sure, yeah. It's a question from Alexandra. I notice when I push my lower jaw forward, everything improves. My airway isn't so tight. My anxiety lowers. I can suddenly breathe into my diaphragm with ease. I would love resources on jaw tension.
So this is another thing that I think I've only in recent years come to respect. But when we breathe, we are breathing through a tube in our neck. If you're lucky, it's about that size, or maybe it's slightly smaller, and it's collapsible at that point. So we need to and when we're asleep, we are just breathing through that tube, and lots of things will make a difference to that. If you do have a lower jaw that's slightly sort of the chin slightly further back, it narrows the airway at the back. Various structural changes in your face depend on like the palate size, etc. So certainly one treatment for sleep disordered breathing is a mandibular advancement device, so the dental appliances, and they bring the jaw forward. But the one aspect that we could do, if we're talking about basics, is actually there is a correct tongue position. So I had no idea as a doctor, and it's another part of my body I now have an immense respect for, because the tongue is an organ that communicates with the rest of the body. The tongue is designed to be up on the roof of the mouth, so out of the airway. And actually when you do it, because the tongue's only connected here, it lifts up here. So the tongue should be up on the roof, flat on the roof of the mouth as best you can do. The tongue's a strong muscle, so you don't want to push it up against the back of the front teeth. So you have the tip of the tongue on the ridge of tissue above the teeth. You want to have your lips sealed, but not clenching, because clenching generates a fight-flight response. So for me, I can't have my teeth in light contact because I just clench. So I have my teeth like that. And actually, that's one part of breathing re-education, is actually to retrain your body to have your tongue in the correct position unconsciously. And it naturally brings the tongue out of the airway and your nasal breathing, because your lips are sealed. Now, obviously, if someone's quite narrow at the back, that won't be enough. And then sometimes people end up with these appliances, but obviously that individual's noticed, so maybe that individual needs to have a little go with the tongue and see whether that helps.
And I think I would think this is a really great time to bring in the concept of upper airways resistance. So this is something that's a relatively new concept for me, despite being a chest physician for however many years. Obviously we know about sleep apnea. So sleep apnea is where the airway collapses, that little tube that Louise has been talking about collapses because of when you are asleep, everything relaxes. You just should be breathing with your diaphragm, and all the airways get floppy here, and they can actually literally, when you breathe in, it can collapse, drop oxygen levels, and then people wake several times, sometimes hundreds of times an hour, to essentially to keep their oxygen supply going. And then become very, very sleepy during the day. So that's very, very well described. But like everything in medicine, it's a spectrum, isn't it? So you can have sleep apnea where it's, very easily diagnosed, sleep study, it's treatable. But then there's probably a whole range of stuff that happens in the lead up to sleep apnea, and jaw position, clenching potentially, being a snorer, being a mouth breather, all of this can lead to airways resistance. So just give us 2 seconds on that, Louise, as well, because it's really a fascinating concept to me.
And I think I probably had it. I didn't have a sleep study, but essentially upper airways resistance syndrome, I think, is probably underdiagnosed, under-researched, and really common in particularly in chronic disease, I think. But essentially it's when the airway has narrowed enough, so it's not completely collapsed, but it's narrowed enough that the body feels a threat to life, and then the body has to generate a fight-flight response to open that airway for that person to feel like the breathing's okay. And the person may wake up, or the person might not do. But if you had a sort of electric like an EEG on, you would see that the person has been aroused out of that stage of sleep, and it significantly fragments sleep, and it significantly leads to symptoms of fatigue and impacts activities of daily living. And I think it is a relatively new condition, and not all sleep studies pick it up. And at the moment, I don't think it's not described in the NICE guidelines that I've seen. So then we don't really have a treatment pathway. But luckily, certainly my sleep clinic, if they think a patient has that and got symptoms, they will treat them. But I think this is a really under-researched area. And I, certainly the traditional medical approach is, let's wait until someone gets obstructive sleep apnea and then treat it. Well, can't we intervene earlier before we get to that point?
And we haven't even really touched on hormones, apart from the fact you've mentioned perimenopausal snoring quite a lot, but there is this whole link with hormones as well. So women of a certain age particularly can suddenly develop upper airways resistance and sleep disordered breathing, and it's related to hormones. And again, very poorly understood, right?
Yeah. It's definitely, the research clearly says that actually our breathing changes in the 3 hormonal transitions, so puberty, pregnancy and menopause. Each of those, we're more likely to get a blocked nose. And if we get a blocked nose, this potentially is a lot more collapsible. And if you get a blocked nose and you don't know the importance of nasal breathing, you got that potential to mouth breathe. But we have a sex switch in asthma. So after puberty, we've got, before puberty, more boys than girls have asthma. After puberty, there's more girls than boys. At pregnancy, we have a steep rise in sleep disordered breathing, and we have the same in menopause, but for different reasons. So I think we need more research on that, because women need to know that in these transitions, my breathing might get more efficient, and actually they might want to improve their efficiency before they hit those transitions. So it's really, really important.
You beat me to it.
Good one to finish. Yeah, good one to finish on.
So while we've got 2 minutes left, I'll read it out. Assuming breathing is more or less normal through the nose, nice and slow, minimal chest movement, etc. at rest, what exercise can you try to increase your tolerance to CO2?
So I mean, this does the thing with CO2, when you're trying to improve your tolerance, we need to do it very, very gently, because it can cause air hunger. And if you cause too much air hunger, it causes a stress response. So you have to be really careful. So obviously, there's such a spectrum. So for example, I have some people who even just getting their mouth closed for 3 minutes. So if you can breathe through your nose for 3 minutes, there was one study that said if you're between the ages of 3 and 83 years old, then there's not a full obstruction in your nose, so you can learn to breathe through it again. And certainly that seems to fit with my clinical practice. But some people will get air hunger just doing that, and that, you can't do the same exercise compared to someone who maybe is breathing more efficiently. So it does just depend. But what I would say is, when you get air hunger, be reassured that most of the time, we did touch on it, that it's not necessarily that your oxygen's dropped. Everybody assumes the oxygen's dropped, and actually it's not, it's that you've hit your carbon dioxide tolerance. So if you can sit with a comfortable air hunger, I don't mean stress, a stressful air hunger, a comfortable air hunger, then actually you're training your carbon dioxide tolerance. So, you know, in some people, just, you know, just breathing just gently, more slowly, and maybe just feeling a little bit like, I'd like to open my mouth, but it's okay, I can cope with that. You know, that sort of thing. There are other exercises, more gentler ones. I have got a video on it, and we said we might tag there's 3 exercises on that. We're probably struggling for time, so we can tag that in, and there's 3 on there.
Yeah, and I think it's just that if you can even breathe just 10% less, that's probably a good place to start. If you know, if you want to start looking at carbon dioxide tolerance, just that very gentle, just slow things down and experience that little bit of air hunger, but comfortably, and not at the point where you are stressing your body, because we it's that fine line between stimulating your lovely parasympathetic nervous system with your lovely slow breathing, training yourself but not triggering fight or flight. So it's that, and then actually having some guidance with that is really helpful, and doing little exercises regularly, I would say, rather than doing big long periods of trying to retrain breathing. I think the more the better that you can do. You get out what you put in. That's what you say, isn't it, Louise? And I think
on that note, I'll just say, with brain fog and everything, do reminders on your phone so that you can remember, because otherwise it's very easy to forget these things.
100%. Yeah. I think there are a few apps that can help you remember to do some of these tasks as well during the day. I don't know if you have any you recommend, Louise.
Not specifically. People have just put like the I don't know a specific app, but just put a reminder on. But obviously you don't want the reminders to cause a stress response, do you? So there's a balance, isn't it? You're going to feel guilty if you're not doing it. And what I would say as well is, at the beginning, there is this. What I'm seeing clinically is sometimes when people there's almost like the body really like overreacts to carbon dioxide, so they might not feel any air hunger at all, then it suddenly hits them, and it can be quite frightening. But actually then what I see is eventually their body seems to sort of notice this, or the air hunger's slightly coming up now, I can adjust it and make it feel comfortable. Whereas initially sometimes it almost comes out of the blue, and almost like their body's sort of doesn't give them any warning. So if it's a little bit sort of trigger happy like that, just go really, really easy on it. Like you say, just reduce it a little bit, and don't even aim for air hunger. Just breathing light, I'd say. Yeah.
And it is probably worth, and we are going to have to stop now, but this always happens where we just got into the, really good discussions. We have to stop. But I think just as a final point, it's worth saying that training carbon dioxide tolerance is something that people can do wherever they are in the journey. So whether you've got a really dysfunctional breathing pattern and can barely exercise, to athletes train using carbon dioxide tolerance, wherever you are on that spectrum, it's something you can always work on and build on to improve exercise tolerance and your aerobic threshold, anaerobic threshold, if you like. And we didn't even touch on children. I think we could have another entire session on children, by the way, because there's so much that I didn't know that I've learned. But I think we have to call it there. But thank you. That's been such a great session, and I think there's possibly a follow-up, a part 2 that we could maybe do, a Q&A, because there's so many questions coming in, and maybe get Robin the physio involved in that as well. But for now, I'm just to say thank you to Helen, thank you to Louise for giving up your time, thank you to everyone for watching and for all your engagement and all your brilliant questions. And the next session is going to be, I think it's the 22nd of February. It's the rescheduled session with Ralph Garbo that got cancelled last year, very last minute, and we've rescheduled that, and I think that'll be a really great follow-on to this one, because that's going to be all about sleep restoration, and breathing's going to be, we're going to be talking about breathing in that as well. So thanks very much, everyone, and have a lovely rest of your evening. Good night.